A new study making a link between a common antibiotic and a higher risk of birth defects. Mandy Gaither has the details.
They're used to treat infections and most often prescribed when a patient is allergic to penicillin. But a new study published in the medical journal BMJ suggests women who are prescribed macrolides during the first 3 months of pregnancy had an increased risk of birth defects compared to those who are prescribed penicillin. The study analyzed data from more than 104,600 children born in the UK between 1990 and 2016. Their mothers were either prescribed penicillin or macrolides. The study found that prescribing macrolides, which include erythromycin, clarithromycin, and azithromycin, to pregnant women during the first trimester increased the risk of major malformations to 28 of 1,000 births compared to 18 per 1,000 births with penicillin. Specifically, the risk of cardiac malformations was higher. This study did not find a link between macrolides and neurodevelopmental disorders, and there was also no associated risk between birth defects and macrolides prescribed before conception. An author of the study says based on the findings, pregnant women and their doctors should find an alternative antibiotic depending on the type of infection. For today's Health Minute, I'm Mandy Gaither.
Study authors also warn about the risk of avoiding antibiotics, saying the infection itself can also be really damaging to the unborn baby. Flu activity across the U.S. remains high, but there is some good news. The flu vaccine is working. The CDC says this year's vaccine has been 45% effective overall, meaning it's reduced flu-related doctor visits by almost half. Its effectiveness is 55% among children who have been hit especially hard this flu season. There have been about 26 million reported cases of the flu in the U.S., with more than 14,000 deaths. A mother's weight before pregnancy could affect her child's behavior. Researchers from the National Institutes of Health followed nearly 2,000 children for 8 years and found those whose mothers were obese before they became pregnant were twice as likely to be diagnosed with ADHD compared to those whose mothers were not obese. Scientists say more research is needed, but if confirmed, doctors may want to screen children of obese women for ADHD.